Good afternoon, parents. Hearty welcome to the workshop hosted by Little Dentist, where we'll help parents in taking care of the children's dental hygiene. Today we have Dr. Tanya with us. She's a MDS periodontist who has been working with Little Dentist for some time now. Good afternoon, doctor.
Good afternoon.
And so topic for today's workshop will be major obstacles to children's oral health and ways to prevent dental decay. So doctor would love your views on this.
Yes, so hello everyone. This is Dr. Tanya. So today I'll be talking about what are the major obstacles in a child's oral health depending upon the age of the child. So as we all know that children's teeth begin forming before birth, and as early as 4 months the first primary or baby teeth begin to erupt. And all of the 20 of the primary teeth usually appear by the age of 3 and according to the pace and order of eruption values. Permanent teeth, whereas begin appearing around the age of 6, and this process continues until the age of 21, wherein the third molars erupt. So, to ensure a proper oral health for a child and a lifetime of good oral habits, we need to follow certain preventive strategies according to the age of the child. So, depending upon the age, we can begin with babies, that is infants, and the age is 0 to 11 to 12 months. And what obstacles we see is the most important one being nursing bottle caries, or also known as baby bottle tooth decay. So, what can be done is to avoid this problem, parents or usually mothers can take a gauze or a washcloth and with water after every feed, they can wipe off the gums. And when the tooth has begun to erupt, they can start with brushing daily with a pea-sized amount of fluoridated toothpaste. One needs to keep in mind that the toothpaste should have proper amount of fluoride, that is 1000 ppm. Then the next obstacle most commonly seen can be thumb sucking, or also known as pacifier sucking, and it is one of the non-nutritive sucking. So basically no nutrition is being derived through it as through a pacifier. And what can be done is that if the child has developed this habit beyond 3 years, parents can come to the pediatric dentist and seek dental consult. Another thing is most commonly seen is the white spots on teeth. So as soon as the first tooth appears at about 6 months, the parents can begin cleaning the child's teeth along the gum line, and they need to lift the lip. Usually, mothers ignore the anterior teeth. They only see the posterior teeth and they feel that everything is correct. But no, we need to lift the lip and correctly do the brushing. So this was until the age of 11 to 12 months, that is 1 years. Beyond that comes the toddler age, that is from 1 to 3 years. And what obstacles most commonly seen are that since the cognitive development has been maturely done in a child, so he has developed a fear of dentists. So as a pediatric dentist, what we do is we allow the child to sit in a parent's lap during the examination, which makes them feel more comfortable. Also, another thing is usually we prescribe antibiotics, but parents what fail to do is give a proper history of the child. So sometimes a child has a allergic response to an antibiotic and staining can develop on the tooth. So they need to give us a proper medical history, and also after we prescribe antibiotic, they need to seek a pediatric consult. Another age group is the grade schoolers or preschoolers, that is from 3 to 11 years. And what they love doing is the love for sweets. So parents ignore their oral hygiene and they feel it's okay. We'll do night brushing and let the child eat whatever they want to do. But no, more nutritive options like vegetables, yogurt, and cheese can be given to the child at night time. Another thing is in teenagers, that is from 12 to 17 years or beyond 13 years, what most commonly seen is injuries from sports. So, as parents need to understand that they need to encourage the child to wear mouth guards during sports to protect their teeth from any potential accidents. So, these were the age limits and major obstacles according to which preventive strategies can be followed.
Got it, doctor. Also, if you could suggest any more preventive ways to basically, work around these cavities that we see in children.
So basically, a lot of myths and facts have been coming around the preventive strategies. So broadly, what needs to be done is one needs to limit the sugar intake broadly to prevent tooth decay. Another thing is, as parents, what they fail to understand is that fluoride in today's day and age is a very important tool in preventing dental cavity. And as pediatric dentists or at home also, they can give them fluoride supplements. If they fail to do so, they can use a fluoridated toothpaste. And another thing is they can come to us at every 3 month interval and we can provide a fluoride varnish treatment. Also, what we can do as dentists is we can give them the child a preventive layer, that is the dental sealant. What is it is made up of a plastic resin, and what it bonds to the tooth and prevents from further cavitation. Another thing, most important, is proper brushing and flossing. What parents do not remember is that flossing is equally important as is brushing to maintaining a good oral hygiene in a child. Also, food choices and what main five food, there is a term known as a food pyramid. So what main constituents come in the food pyramid is fruits, fiber, vegetables, whole grains, and calcium. So calcium is a prime ingredient for preventing tooth decay, especially for growing children. And dairy is a great source, for example, milk, yogurt, and cheese. And also fruits like apple, bananas, oranges, and obviously whole grains, which contain vitamin B and iron, helps in maintaining gum health as well. So all of this can be done, and also there is no need for parents to strictly avoid sugar. You can give munchies to the child, but also focus on a healthier munchie, which is not sticky and which does not cause any tooth decay in a child. So these things can be done to maintain proper oral hygiene.
Got it, doctor. Thanks a lot for all the information that you have given us today, and
Most welcome.
thanks for helping us out with this workshop. Thank you, doctor.
Thank you so